Hi, this is Dr. Kimberley Linert, author of Visualizing Happiness in Every Area of Your Life and host of this podcast, Incredible Life Creator. And today I have with me Dr. Victoria Mondloch. Hey, Dr. Vicky.
Hey, Dr. Kimberly, how are you?
I am great. I am so excited to have you on here because we're going to talk about some things and some resources that a lot of people aren't aware of. So I'm very, very excited about that. But before we do, I'm going to go ahead and read your bio so people know who you are. So Victoria J. Mondloch is a recently retired physician from Wisconsin, president and founder of Victoria J. Mondloch, MD. She was also the medical director of Wisconsin Stem Cell LLC. With over 35 years of experience, she specialized in women's health, family medicine, and preventative health and wellness. Dr. Monlock earned her medical degree from the Medical College of Wisconsin. Her approach was to educate and empower her patients to better understand their bodies and maintain healthy lifestyle habits. Dr. Vicky specialized in bioidentical hormone counseling for women and men, recognized as the National Association of Professional Women VIP Woman of the Year by the National Association of Professional Women and Medical Director of the Year 2020 by International Association of Top Professionals as well. International Association of Top Professionals, Most Empowered Female Physician of 2022, and Lifetime Achievement 2023. Currently, Dr. Vicky is pursuing her passion of patient education using her original patient hormonal research. You've had a lot of awards, so congratulations on that, and I'm sure well deserved. Uh,
Thank you. Thank you very much.
Yes. So I know you just didn't arrive as this famous doctor. So how did it all start out? Tell us about you.
Well, the interesting part of it is that I never thought I'd be a doctor. When I was in high school and I was getting ready to write my speech to my class, one of the teachers I never had was looking over my shoulder. And he said, I just want to see what you're going to write to your classmates. And I said, well, get out of here. You'll hear it at graduation. And he said, well, I want to know what you're going to be when you grow up. And I said, well, I want to be an interpreter for the UN in foreign languages. And he crossed his arms and he just started laughing. And I said, you have no right to laugh at my dream. You never even had me as a student. I said, if you're so smart, what am I going to be when I grow up? And he said, a doctor. And I thought, oh, that's a hoot. So I went home and I told that story to my dad, and he just crossed his arms and he goes, why not? And I thought, oh my gosh, you too? So literally, I went to college thinking I could do science and foreign language. Well, they don't work together. You just can't put 4-hour science labs in and do anything else as a minor. It doesn't work. So when I graduated with all my science degree, I did research for a bit, got into medical school, and literally my first year in medical school, I died on the operating room table because I had a ruptured appendix that nobody recognized. I was the only one that kept saying, couldn't this be a ruptured appendix? No, 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 no. 5 different specialists. No, 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 no. It can't be that. Well, this is pre-ultrasound, pre-CT scan, pre-MRI, and it was just your assessment of the patient's, by physical exam, and then them telling you their story. Well, when they opened me with the wrong incision and the wrong diagnosis and realized what I had going on, they literally had to bring in another surgical team. Well, meanwhile, I had so much infection in my abdomen from the peritonitis that I went flatline on the table and they had to bring me back. And when I literally came to, there was a gentleman at the end of my bed. And you know what it's like coming out of anesthesia. You kind of take toothpicks and, oh, is that somebody there? And so I'm looking at this gentleman and he straightens up and he goes, well, I'm here from the medical college. And I'm here to tell you, you missed your exams and you're going to be kicked out of school if you don't make them up. I have an NG tube in, dual IVs running. I haven't even seen the surgeon yet. My surgical dressing is still on. And I said, do you know what just happened to me? And he goes, no, and that's none of my concern. You just need to get back to class as soon as you can. And I thought, oh my gosh, this is how they treat their own kind, you know? So I almost quit medical school over that. And I thought, no, you know what? Stay and be the change agent. And so that became my kind of mantra is medicine is broken and it needs to be fixed. So when I went out into my residency in OBGYN, it was also very similar that women were, yes, our bread and butter, but nobody was really listening to them. And they had concerns and questions that nobody was paying attention to. And then I had my own issues with perimenopause. And I thought, I don't even know how to answer my own question. And my best friend, office manager, looked at me and said, well, Doc, if you don't know the answer, how do you expect your patients to know the answer? And it was boom, she's right. So that started my journey of 20 years of consented research with my patients to come up with what my two books talk about, which is basically how do you understand your body with hormone change?
Wow. And that's a good question because I think women all over the world are asking those questions.
Right? Medicine does not give you the answer. And ironically, it isn't taught in medical school. I would I would ask every patient that would come into my office, have you ever had your hormone levels checked? And they'd look at me like, what? Well, no, I'll show you all my blood work. And nobody had ever bothered to check their hormone levels. And that literally became the focus of my research was how do we put the science to what's happening to women as their bodies are going through hormone shift, not just with adolescence, but with perimenopause. What happens in menopause? Why are we prone to breast cancer when we don't make hormone anymore? What is going on here that we just don't understand? So that was really what drove me to write my two books about women's health.
Yeah, and that is a good question. I mean, when all of a sudden, well, I experienced this a couple of years ago. So all of a sudden, I've always had really oily skin, and all of a sudden my skin is dry. And I'm going, what's up with this? And my whole life always been cold. I'm always cold. Everywhere I go, I want them to turn up the heat because I'm freezing. And now all of a sudden, I'm hot. I'm hot everywhere. And 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 it's just shocking. And you wonder what is going on. And I'm not
Hormone
doing
shift,
anything different. I'm not eating anything different. I'm not
right?
exercising. What happened?
Right. That's exactly right. There are so many things that happen to women that when you go to your doctor and you say, this just happened to me, they don't understand. So they try to shift it to something else. Oh, well, you must be depressed. Wait a minute. Where in there did I say I was depressed? I said I'm feeling hot all the time. I said my skin has changed. Where did you get depression out of that? Well, that's what their comfort level is in dealing with women of that age. Oh, you must be depressed. So therefore, there's something you're not telling me. So I'm just going to change your narrative and call you something else because I know what to do about something else. I can treat depression. And your concerns, your symptoms just get dismissed as if you don't know your body, you don't know what you're talking about. Well, who best to know what you're talking about? You live in your body every single day, and you're not doing anything any differently. So, what really is happening? Where's the science to what is changing in my body? Nobody's checking. They just assume, well, it's all in your head. You're just imagining that. Give it a week, give it a couple of weeks, and you'll find that that's going to all change. You'll be fine. Oh no, I've been doing this for how many months now? And it's not getting better, it's getting worse, and I'm not changing anything. So again, where's the science? So my premise is, guess what? There is an actual science-based graph of what your hormone levels do over the course of your menstrual career from puberty, age 12, to menopause in the US, average age 50 and a half. So, what happens over those 38 years? Do we just make hormone and then we stop making hormone? No, it's never that simple. So, the science is that yes, it's a relative bell curve, but we have these major up and down swings in our adolescence. When we hit our years of childbearing, 20s and 30s, it's in between the 80th and 100th percentile. We hit perimenopause and boom, we do those same wild swings. And it's, if you average it, it's a bell curve, but the wild swings are still pretty wild swings. Imagine 1 month your hormone levels are 85th percentile, the next month they're 15th. Whoa, that's a pretty big swing. Are you going to notice that? Oh, yes, you are. So if you do that month to month to month to month, you're going to feel like you are crazy. Like, what, how do I explain this to somebody else? And besides that, hot flashes or feeling warm all the time or skin changes, you may not realize that migraines are a part of hormone shift. That foggy brain is a part of hormone shift. That sore muscles and bladder leakage and increased acid reflux, it's a head to toe experience. And some women have completely different symptoms than their best friend or the woman sitting next to them because everybody has their weak spot where they're going to see their hormone change affect them the most. So I have a set of symptoms that I developed, a much broader set of symptoms than what the North American Menopause Society has posted because it encompasses most of the symptoms that patients will actually walk in with. Doc, I'm losing my hair. Doc, I'm gaining hair. I'm shaving. Oh my gosh, I've never shaved in my life. Why am I putting weight onto my belly when I'm eating less and exercising more? Why do I eat 3 bites and I have to unbutton my pants because I'm so bloated that I can't stand it? Why are my breasts so tender? These are all legitimate symptoms that most docs just hear them and they nod their head and they go, well, it'll go away. Oh, well, wait a minute. Go away when? What do I do about it? I'm not going to buy a whole new wardrobe professionally because I have to unbutton my pants every time I eat lunch. That just isn't going to cut it. So, women, we need to help you understand that there's science behind what is going on and that you're entitled to use a resource like my hormone symptoms worksheet. You're entitled to identify where your hormone levels are in relation to where they should be. And are they changing month to month to month? And what can that look like? And what can you do about it, most importantly? How can I mitigate? How can I help navigate this time? Because I may be in this from age 40 to 50. That's not just a couple of months. That's 10 years. Holy smokes. I don't know if I can do this for 10 years if I don't understand what's going on. Well, that's the purpose of why I wrote Full Bloom, because it's all about how do you understand what's going on and not only debunk the myths, but tell the truths about what is happening in your body. And in Full Bloom, there is also what I refer to as that hormone symptoms worksheet, and it's a rather large list of symptoms that you'll see, and they're marked as estradiol deprivation, meaning too low estrogen, they're marked as too low progesterone. They're marked as too much testosterone. Well, isn't this a great resource that you can use to organize your own symptoms and many times go, oh my gosh, I never knew deep fatigue was related to low estradiol. Oh my gosh, I never knew that water retention and feeling like my ankles are 3 sizes bigger than they should be. I never knew that was related to too low of a progesterone or putting mid-abdominal weight gain on. We work really hard to keep that weight off. Where is this coming from? That's too much testosterone. So, or my biggest one, why do doctors think that low libido or changing libido in women is due to low testosterone? It isn't. It happens at a point in time in menopause when we have too much testosterone with almost no female hormone. So if we're already, quote, menopausal or male, ooh, why does low libido get treated with testosterone? We already have more testosterone. So what are they trying to do to us? Have us grow hair, lose hair, put on mid-abdominal weight gain? Why are they trying to turn us into men? Our libido is actually from low estradiol. We're women. We work off of a female metabolism. So give us estradiol. Give us our libido back with estradiol. But then we have to balance with progesterone because too much estradiol can actually get us in trouble. There are cancers that we can actually have happen to us because of estradiol dominance, like breast cancer, like ovarian cancer, like uterine cancer. So we need estradiol, but it has to be properly balanced. And that's the whole point. But before you even get to menopause, you still need to know that there are these symptoms that can happen to you for 10 years. And you don't want to just suffer with them and keep adding more to your list. You want to take the check marks off of this list and you want to actually know how you can manage your symptoms. But how do you know that your symptoms are there unless you have a checklist to work off of? That's why this worksheet is such a great resource.
Yeah, yeah, that would make it clear. I don't think my doctors know anything about that. They just use blood tests. They just use blood tests and look at them and try and balance things. But I know when I started working with a doctor, all of a sudden I got that what you were talking about. All of a sudden I got a big stomach and started gaining weight everywhere. And I was
Mhm.
doing intermittent fasting where I was eating one meal a day, and I'm like, how can I be gaining weight when I'm eating only one meal a day? And
Right.
supposedly we were balancing my hormones. So here's the big question. So I've heard of, people say they just don't do anything. They don't take any hormones. Some people get those compounded hormones. Some people say just use this vaginal cream. Some people say use this wild yam cream or these other creams you put on you. So what are we supposed to do when we have all these unbalanced things? And where do we get the stuff to do it with?
Great questions. Absolutely great questions. Well, number one, you do need to do the blood work, and salivary won't cut it. And so, whenever I have another doctor say they do salivary and their patients are now jumping ship from their office to my office, usually they'll say to me, I don't understand why they're getting results with you, but they weren't getting them with me. And I'd say, you did salivary testing. Well, what's the difference? You're getting the same balance either way. And I'd say, well, I want to ask you a question. When you measure saliva levels, you have saliva in your mouth and in your GI tract, right? Yeah. I said, okay. If you have muscular aches and pains, how does saliva measure what's going on in your muscle? Do you have saliva in your muscle? Hmm. Do you have saliva in your brain for that brain fog? Do you have saliva in your joints for joint pain? In other words, salivary levels are not a proper reflection of what's going on in the different areas of your body. So why do we use it? Well, that's a great question. I think because it's easy for some people, they can order it on their own. But what most patients don't realize is if your doctor won't order your blood tests for you, here's a little secret. You can order them yourself online.
Mhm.
What? Really? Right. You can. And so you can use some of your healthcare benefits, like your HSA and your FSA, and you can actually order your own blood work. And then once you have that blood work done, you can have it sent directly back to you so you have control of it. You can share it with your doctor. They may or may not know what to do with it. You can share it with a different healthcare provider who may know what to do with it. And that's the whole point is women, we need to let you know that you can take charge of your own health. And yes, are there things you can take? You mentioned compounded, and compounded is simply making it instead of what the pharmaceutical company makes. So a compounding pharmacist will physically make it. Now they're using the same formulas approved by the FDA that pharmaceutical companies use, but they're able to use things like adding a slow release factor to something like progesterone. And progesterone is made from yams, but you'd have to eat a truckload of yams to get what you'd normally get to influence a progesterone blood level. But progesterone is that hormone, that second female hormone that we need to have. You can apply progesterone topically. You can also take it orally. There are bioidentical progesterones, but unfortunately, you may only be told by your doctor about the chemical progesterone, which is foreign to your body, and your body doesn't really handle it well, and people have lots of side effects from it. It's called Provera or Depo-Provera as a shot, or a Mirena IUD, which has artificial progesterone in it. All of those are potentially really going to give you increased risk of depression. They're actually associated with an increased breast cancer risk.
Mhm.
Let me say that one more time. Associated with an increased breast cancer risk. So why don't they tell us this? Well, is bioidentical progesterone associated with an increased breast cancer risk? No, no. By the same token, the estradiol, which can be used in many different ways orally, as a cream, vaginally in a ring or in a gel or in a cream, those estradiols can be pharmaceutical as bioidentical. They can also be compounded as bioidentical, but it has to be bioidentical versus something pharmaceutical and non-human based. So women, if you are on some sort of hormone and you're wondering if you're on the right hormone, make sure it is estradiol and that it is not Premarin, because Premarin, most women don't know what Premarin means. Premarin is actually pregnant mare's urine. What? Pregnant horse pee? Yep. And if you're on Prem Pro, that's Premarin, the pregnant horse pee, plus a synthetic medroxyprogesterone acetate, the Provera, that is giving you the increased risk of breast cancer. So there are good bioidentical hormones that can be either pharmaceutical or compounded. There are synthetic or horse-based that have nothing to do with human-based bioidentical hormone. So therein lies the difference, and it can be quite confusing because many physicians were only told they could use a pharmaceutical route, and all they knew about when they trained might have been Premarin and Prempro. Well, that's not what you want at all.
So, for people who don't know, what's the difference between the chemical pharmaceutical estradiol and bioidentical. Bioidentical. What does bioidentical mean? So obviously it's not from horses. So
Correct. It
it's
is
from humans. I mean,
biologically, right. It is biologically identical to the human estradiol that a human ovary makes. So there is a pharmaceutical bioidentical estradiol that is safe to take. However, it may come with a blue dye in it, and many people don't want a blue dye. So they may shy away from a pharmaceutical estradiol, even though their insurance will pay for it because of a blue dye. Okay. But if they want a compounded estradiol, they can have a compounding pharmacist make that estradiol for them. It's the same estradiol that a pharmaceutical house is using. They're human-based bioidentical estradiol formulas. It's the same formula. It's just whether it's made by a compounder and they're not going to put a dye in it, or whether it comes from a pharmaceutical company and it may or may not have a dye in it. So. And it's the same with the progesterone. There are progesterones that are made by a pharmaceutical company that are yam-based and human-based progesterone as if it was the same out of a human ovary. A compounder is also going to use that same formula, but they can change the dosing and they can make it a slow release that is non-drowsying versus the only way a pharmaceutical company makes it is one way, and that's in a few doses only, and it's very drowsying. So you have to take it at night. And so there are options, at least. A pharmaceutical company is only going to do oral. A compounder can do oral, topical, troches, which are like something that will dissolve under your tongue, or liquid, or both pharmaceutical and compounding will also do vaginal creams.
got it. So you're talking about all these different hormones that we take. So these hormones we can't get from our foods. Like you said, you would have to eat a lot of yams.
A
So we can't
truckload.
get it from our food. So as we get older, get into menopause and even out of menopause, where do the hormones go? And why don't they come back? I mean, what's happening there?
Well, the interesting thing is, historically speaking, back in 1912, menopause didn't exist as a term. Our average lifespan was 48 and a half years old. So we hit, quote, menopause age and we died. So it wasn't even a term, it didn't exist. Well, there were many things in 1912 that didn't exist that have increased our lifespan artificially, things like safe surgery, anesthesia. Goodness sakes, we didn't have anesthesia to put us to sleep. We had to bite on a stick or a rod, and we had to use alcohol, and that was quote unquote anesthesia. Well, it wasn't anesthesia at all. They just got you drunk, so you wouldn't remember the pain that you had a surgery with. But people died from appendicitis. They died from a ruptured gallbladder. They died from things that today we don't die from. So we have learned how to bypass clogged arteries in a heart. We have learned how to get people past a stroke. We have learned to actually prolong people's not just longevity, but quality of life. Yet our body evolutionarily was designed to stop having babies at age 50. We're living longer, we're healthier, but do we really want to have babies at age 60 or age 70, even if we're healthy? Well, our body physiologically and evolutionarily is not designed to have our ovary continue to work that long. And that would be something that would happen over probably hundreds of years if we continue to live longer. But that bell curve that I told you about, that is something that is going to be what dictates how our ovaries work. Our ovaries start with puberty and they end with menopause, age 50 and a half, and that curve of what happens is actually something that would take a long time to change. So we're pretty much, as women, going to stop making our hormone at age 50, even if we're in good health. Men, unfortunately or fortunately, have a different curve. So our curve looks something like this, and there's a separate curve for the adolescent years, but you can see over here this up, down, up, down. That's what happens in your perimenopause, your 40s. The same mirror image of this happens over in adolescence over here. But then we stop. Now, the male curve, and I haven't written the male book yet, but the male curve is a completely different kind of curve. And that curve actually looks like this, which means that at age 20, they're making 100% hormone. But
Mm.
even all the way out at age 100, they're still making hormone. What? That's crazy, right? Men continue to keep their testosterone production going. Women stop. Was this designed that, again, we just aren't going to be having babies at age 60? Who's going to raise them? Are we going to be around to raise them? So, evolutionarily, that's something that may change over time, but that's the stage of where things are.
Yeah, because people are living longer and longer, and
Right. And we will spend as many years in our postmenopause as we did in our menstrual career. Think about that. We will have as many years without hormone as we did with hormone. Well, if hormone is part of how our brain functions, how our muscles function, how our joints function, how we keep healthy bones, how we don't lose our teeth because our jaw deteriorates, how we actually prevent Alzheimer's. What did you just say? How can you prevent Alzheimer's? It's by maintaining at least a minimum of balance in your hormones, all of your hormones, but especially in maintaining female hormone in your body. Whoa.
so does that mean that forever, once women are like 50 and above, that they have to take hormones for the rest of their life?
Well, if they want to prevent osteoporosis, if they want to prevent jawbone loss and losing their teeth by age in the decade of their 70s. I've had women come in and say, I'm healthy. Um, but I have to get every tooth in my mouth pulled and have implants because my bone is so rotten. What's going on? What did I do wrong? And it's that what women are also never told is that unless you have a minimum blood level of estradiol in your system, you cannot absorb calcium from your diet or from any supplement you take. You can take it, but you're simply going to pass it out. You don't absorb it. Well, if you never absorb and replace calcium in your body, but you use it in muscular function, you're going to deplete the calcium in your body little by little by little by little and never put it back. It's like having a checking account with all this money in it and you keep writing checks, but you never put anything back in. All of a sudden, you write bad checks that nobody's going to be able to check, there's nothing there. So you have to put calcium back in the body. Well, what if you can't absorb it? Well, then your body goes to the bone bank, your bones, your bones, your hips, your spine, your femurs, and it will steal calcium from your bone bank. And it's not able to put it back in because you can take all the calcium you want and you're not absorbing it. So at some point you step off the curb and all of a sudden you break your hip, you break your femur, and you go, wait a minute, I just stepped off the curb. Well, it's because you had a shell of a bone without any of the inside there, and you stepped off with just enough force that it caused that fragile bone to break. Or you fractured a vertebra in your spine just by sitting down too hard in a chair. So, is that really what women want to look forward to, they're never told that that's a risk. So it is important for women to know you need to have a calcium or an estradiol level of 30 when 100th percentile back in your 20s was a level of 300.
Mm.
Whoa, where does that number go with menopause? Many times when I check it, it registers less than 5. Well, that's not 30. It's not 300, but it's not 30. So if you spend 5, 10, 15, 20, 30 years and you never are able to replace calcium back in your body, it is basically inevitable that at some point you will have a bone fracture when you didn't expect it. And that's usually going to be something that will lay you up much longer because now you're healing a bad bone. You don't just heal a bone break by putting a cast on it. There's only a shell of that bone. So, how do you adequately heal a bone? By the time you take the cast off, you do something, relatively simple. Carry a bag on that arm and crack, you're going to break it again because it's not good bone. So, women need to know that they can do something about preventing that from happening to them. And they need to know that Alzheimer's is actually something that is preventable and reversible. And one of the basic tenets of preventing Alzheimer's is balancing your female male hormones. What?
What? Yeah, this is new information to me.
Right. And I'm not just saying this, this is coming from a neurologist out of the Keck Institute at UCLA. And his protocol for what you can do to not only prevent but reverse Alzheimer's is actually balance your hormone groups. And when he lists the 4 hormone groups, your female male hormones is one of those groups.
So interesting.
Wow,
Yeah.
right?
Well, I'm loving this conversation, but we're getting towards the end of it. So, if people wanted to work with you or connect with you, where do they find you? Where do they find your book?
Well, my 2 books, Full Bloom is the perimenopause, menopause, postmenopause book. My second book is Blossoming, which is for the adolescent, the other time when those hormones go up and down. And both are on Amazon, available in print and Kindle. And I'll put in the chat my website, which might be the other easiest way to get a hold of me. And that is drvictoriajmondloch.com. And that's one of the other easier ways to get a hold of me.
All right, great. And I have that in the show notes. So that'll be all in there for people to find. So that will be great. So now I have a personal question for you. What gives you the most happiness and fulfillment in your life at this point?
Oh my gosh, even though I'm retired, I literally have not finished my mission. My mission is to continue to educate and empower women about their health. It is hugely important that we understand how our bodies work. And so, yes, I'm retired from one-on-one in office work, but that doesn't mean that my work is done. So I love educating. So podcasting is hugely important. I work with businesses as far as corporate health. I do a lot of speaking. And so it's getting the word out so that we literally can work with our body in the way that we want to. We don't want to be a victim in our own body. We don't want somebody else telling us that we're crazy. You're not having those symptoms. You're depressed. No, 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 no. Because you know what that ends up with? Depression medication, which guess what? It isn't going to work. So what are they going to do? Raise the dose. Oh, that didn't work. Well, we'll try a second medication. All of a sudden, you feel lousy because you're on medication you don't need. What is wrong with that picture? A lot.
Mhm.
So don't let yourself be a victim. Take charge. Put your symptoms down on that hormone symptoms worksheet. Get a hold of Full Bloom and look at that hormone symptoms worksheet and mark what you need to talk to your doctor about. Bring the book in with you when you go to your doctor and say, I want, as the last chapter of this book says, in how to talk to your healthcare provider, I want these labs done, and this is why. And this is the doctor who wrote this book, and this is why I want you to do this for me.
Mhm.
And so if they won't do it for you, then guess what? You might have the wrong doctor.
Mhm.
You might need to go and find a doctor who will listen to you.
Beautiful, great advice. So thank you so much for being on the podcast and all your great information.
My pleasure.
Oh yeah. So I have one last question for you. So what is your best advice on living an incredible, amazing life?
Oh my gosh. I absolutely adore my husband and my girls. I absolutely love and I cherish my times with them. We vacation together. They want to vacation with their parents. Um, we have raised three wonderful daughters who are very, very different in their walks of professional life. And they all are very able to speak their mind. And so being able to educate and empower patients, my own family included, is really what gives me the greatest joy. And I absolutely love what I do, and I wouldn't change it for the world.
All right. Well, thank you so much.
My pleasure.
We'll talk to you again soon.
All right. Take care.